Hello friends and welcome. I am Dr. Jaideep Somvanshi and I am a coloproctologist by profession, and I'll be inviting you to the video series which we are conducting at Panacea Clinic Nasik. Panacea Clinic is a super specialty coloproctology center, and we are running this from the last 4 years, and we deal with complicated conditions of the rectum, anus and the colon like piles, fissures, complex fistulas, constipation, rectal prolapse, pilonidal sinus, etc. And in this video series, I'll be taking different topics, subjects, and we will be in short discussing what we can do to prevent happening of these diseases. Secondly, if you have these problems, how we can deal with it with home remedies and lifestyle changes. And also we will be discussing the treatment that is available for all these conditions, which may be medicinal, surgical or any holistic management. So let's begin. So the first topic for today that we will be taking is constipation. So the constipation is a very common problem of the gastrointestinal system, and it is too much prevalent in the society. Most of the people are suffering from it, but they don't come and consult with a doctor until the problem becomes very severe. So in the early stages, you never notice it. People are mildly constipated. They just go on having their routines and eating whatever they want and having all kinds of lifestyle that they are living. But as the age progresses, these conditions become more and more complex. They start giving you pain, they start giving you trouble, and then you feel the need to go and see a doctor. Many times there is also in our Indian society there is a stigma that we are suffering from a condition of constipation, and there is also some factor that women are suffering more than men, so they hesitate to tell anyone in the family, or they hesitate to go and see a doctor for it. And in the time lapse, what happens is the problem becomes quite chronic, and simple medicinal management or home remedies are not possible, so many people have to undergo a surgery. So I would like to suggest that whenever you have such problems, make it a table discussion, discuss it with your family, discuss it with your family doctor, so you can get a proper advice on it. So the most important question is, what is constipation? Constipation can be different for different people. Some may have trouble passing motions in the morning, they may have pain passing motions in the morning. For some people it is not that painful, but the frequency is very low, like they are passing fewer than 3 times motions per week. For some people, the quality of stools that they are passing, it is very hard and lumpy. So as I told you, constipation can be experienced differently by different individuals. So today we will be discussing the causes of constipation, its common symptoms, how we diagnose constipation, and what we can do to prevent it. So starting with the causes of constipation. Constipation can be caused, there are many factors, and many individuals in the society, right from children to old age people, can suffer from them. And it is most predominantly seen in women more than men. So the ratio is approximately 2:1. So 2 women for every 1 male is suffering from constipation in our country. The main causes are inadequate fluid intake, very low amounts of fiber in the diet, improper sitting positions. There is no time schedule when you are having your breakfast, lunch and dinner. Ignoring the urge to pass bowel movement is one of the main reasons. Misuse of laxatives. Many people are using laxatives, and after some times they are completely dependent upon the laxatives, and the doses go on increasing and increasing, and the stage comes when they don't take their laxatives, they are completely constipated. Some of the other reasons are some diseases can also cause constipation, like Parkinson's disease. There may be diabetes in there may be constipation in a patient suffering from diabetes. There is also seen constipation in the people suffering from hypothyroidism. Medications is one of the reasons. There are some medications that can cause constipation, like opioids or analgesics or pain reducing medications. Also some medications for blood pressure, like calcium channel blockers, can also cause constipation, and many other things are there. So most probably the bad food habits are the reasons, and if there is lack of exercise, lack of physical activity, can also cause a lot of constipation. And acidity related that is, the digestion is somewhere impaired, so the formation of stool which is happening is not proper, so that can also lead to constipation. And there are some other reasons where the colon is, the digestion is proper, but there is some anatomical changes happening in the colon, and which creates an obstruction for the stools to pass out of the rectum. So these are obstructed defecation syndrome, very slow colonic transit time in some patients which are suffering from paralysis or have been bedridden for a very long time. They have a very slow transit colonic time, so that can cause a lot of constipation. There is pelvic floor dyssynergia, and also some conditions in the rectum and anus like rectocele, rectorectal intussusception, and descent of anorectal junction. So to summarize, constipation causes can be different in different kinds of people. So we need to reach to a diagnosis first, what is the reason for constipation, and then we need to treat the patient accordingly. So for understanding constipation first, we need to understand how our digestive system and our colon works. So when you ingest the food, it is passing through the stomach, it gets mixed with the digestive juices, it enters the small intestine where the nutrients are absorbed, and after that, on the last part, that is ileum, which is the last part of the small intestine, it enters into the colon. The colon is, as we all know, a muscular tubular structure which is almost 1 to 1.5 meters long, and it has four main functions. So the function is that it absorbs the water and salts from the stools that are formed, so the stools become firmer and drier when they pass through the colon. Secondly, it holds the waste until it is expelled out of the body. It helps in evacuation of the waste and slowly propels it. As it is a muscular organ, the contraction of the muscle helps to propel the stool out of the body, and it also stores the waste until it is expelled out. So these are the main functions of the colon. And whenever we see a patient and we need to diagnose the patient, what we do is we ask a few questions, that how much is the frequency, how many times in a day you have to go to pass motions. Secondly, how is the consistency of the stool. Consistency is the most important question. So how hard is it or how soft is it? For this purpose, we show the patient a small scale, which is a Bristol stool chart. So there is a 7 pictures or different kinds of stool, right from type 1 to type 7, and we ask the patient to tell us how your stool looks like, so the patient can do a self-assessment, and it can also help the doctor in understanding the disease, and it can also help the patient to give a personal feedback. And after the questions, that frequency, if he is evacuating the motions completely, if he has the urge to pass motions normally per day, these all questions help us in diagnosing the condition, and accordingly we can do its treatment. So now we'll talk about some of the symptoms that we see in constipation. Most people experience different symptoms, but I'll try to summarize all of them in this single section where we will be talking about the things that patients feel when they're constipated. So some of the common things are difficulty in expelling motions out. Patient feels that the stool has come to the rectum, but there is difficulty in passing the motions out. This may be because of some kind of obstruction or rectocele or rectorectal intussusception, which is also called as obstructive defecation, and that is a very difficult situation. Patient is having the urge to pass motions many times a day, but whenever the patient goes and strains, some of the stools are coming out and some of them are retained inside. Other most common symptoms are like excessive straining. The patient needs to strain a lot, so much that he is exhausted almost sitting in on the washroom. And other symptoms are patient is having a feeling of incomplete evacuation. He feels that something is still being retained inside even after passing his motions. He is passing hard or lumpy stools, which may be as a result of dehydration or a very low water intake. Abdominal bloating, pain in the abdomen, abdominal fullness and discomfort are some of the other functions. Prolonged time in the washroom, sitting for long duration, as he has the feeling that he has not yet evacuated, which should be actually avoided. You should not sit in the washroom for more than 10 minutes. And need for, in some severe cases, there is need for a manual maneuver. You have to massage the abdomen, or some of the people need to apply pressure around the anal region, or some people even have to evacuate themselves with their fingers. They have to remove the stools, and these are very serious symptoms, and eventually they can lead to other conditions like formation of fissures, piles, and anal spasm. So constipation, as you know, we've discussed all these symptoms, so you should not ignore it, and you should always seek help whenever is needed.